Take you back to the story now. There's been much criticism to the passing of the National Health Insurance Bill in Parliament yesterday, with some organizations and even medical aids saying it wouldn't work unless government fixes what is currently the problem. Let's talk to Dr. Crisp now from the National Health Department. He's the National Health Insurance Deputy Director General. Dr. Crisp, thank you very much for staying on the line with us while we sorted out the network issue. You and I were talking about your understanding as the Health Department of why, there are detractors in terms of the bill going ahead. They're not necessarily saying that it doesn't look good on paper. Their concern is how our health system currently is and whether or not the NHI will actually be able to work with the support that it won't get with the system looking the way that it is currently.
Yeah, thanks very much. Sorry, I'm sitting in Cape Town. There's very bad weather here around the airport.
Right.
Obviously there are going to be detractors, people who are trying to protect their business models and to make money. That's not our job. Our job in the National Department of Health is to protect everybody, all 61 million people, whether you have money or you don't have money. And at the moment, we have a very duplicative two-tier system where we spend more than half of all the health spending in the country on around 16% of the population. It's extremely expensive. It's administratively expensive. It's fragmented into, at the moment, 72 different medical schemes. And it's just not sustainable in the private sector. In the public sector, we spend about 5,200 Rand per person per year and 27,000 Rand per person per year in the private sector. You just can't compare the two. And what's happening is that the resources are sucked out of the public sector into the private sector, and it makes it impossible for the public sector to retain personnel and to deliver a good service to the majority of people. So what the National Health Insurance Bill tries to do is to create a framework where the two sectors work far more closely together, where we don't have this complex financing model, and we follow the principles and the structure of universal health coverage as we have signed at the United Nations. So this is not something unique to South Africa. What's unique to us is that we have this terrible dichotomy, and we have a society that is so unequal, and we can't sustain it. We need to address the whole system, public and private. So we're not apologetic about the fact that the reforms are going to disrupt people's business models, and we're very happy that we will include all public and private providers as the National Health Insurance rolls out. But I want to just clarify, we're not at the point of regulations yet. So I heard little bits of that previous interview with Sama. We are nowhere near there yet. We have just gone through the National Assembly yesterday. It's still got to go to the NCOP. And so we're not at a position where we can start to design and publish regulations yet. So people are running ahead of themselves.
All right, but in terms of the funding, where will the funding for the NHI come from? Because already National Treasury was asked a question, and our understanding is that they're not going to allow it to come from value-added tax hikes.
Yeah, look, I think also people are either deliberately misunderstanding or just not listening. We spend a lot of money on healthcare in this country. We spent over 550 billion Rand last year on healthcare. That's 8.5% of GDP. Now, 49% of that is spent already in the public sector. So the majority of the funding that will come into the NHI is already in that half. When we come to the contributions that are being made in the private sector, the only way to move that money into the fund is through taxes. Now, whether that is through VAT or whether it's through other forms of taxes is a matter for Treasury and a money bill later. But what the National Health Insurance Bill does is it creates alternative mechanisms which are not currently existing, such as a payroll tax. We do know that 277 billion Rand was spent in the private sector last year, looking after about 16% of the population. So that is hugely wasteful, it's very duplicative, and it's administratively intensive. We could do with a lot of that money to improve what we are doing in service delivery rather than in paying people to administer the money. So it is complex. I'm not trying to make light of it, but there's no reason why we can't, over a period of time, move money to make sure we all get decent health care.
Do you know, Dr. Crisp, exactly where we'll start off? I mean, we have the outgoing health ombudsman, Professor Malakhaburu Makgoba, who was appointed by government, describing the health system in South Africa as something dire and that has gotten worse, worsened obviously by something such as COVID-19. And so, there's people who are thinking, okay, if I'm going to have access to quality health in the public health sector, how will that happen when you have babies being put inside cardboard boxes at a hospital in the northwest, when you have the Charlotte Maxeke Hospital not coming back into its full capacity after burning almost 2 years ago now?
Yeah, so look, let's first of all admit there's lots of problems in the public health sector. There are also massive problems in the private health sector, and none of them is anything to try and wish under the carpet or sweep under the carpet. We need to repair all the things that are unacceptable in our healthcare. But it doesn't mean we don't need to plan for the future and don't need to provide a service for the future. We do, and we need to fix these things as we go. But we talk as if those things that are broken can't be fixed, and we talk as if that is how it looks in every single facility. It's simply not the truth. There are very good services and there are very poor services in both the public and the private sector. We are not talking about switching on the NHI on the 1st of April next year. There's a lot of work to be done, and there's money that will need to be spent more wisely, and we know that those things need to happen. We are not happy that each of the 9 provincial departments pretty much does what they, looks after their own services and often duplicates what has already been done in other provinces. And that is partly what is dealt with in the bill and Section 32. Everybody ignores Section 32 and goes straight to Section 33, which deals with the private sector. The whole health system needs an overhaul. And so we're not suggesting that you don't need to fix the public sector. But what we're saying is that you can't have only fixed the public sector. Then we would need to raise the taxes now and increase the 5,200 Rand per person that we spend to 7 or 8 or 9,000 Rand per person immediately. So I can't see that kind of tax being made available to us at the moment either. Besides, the resources are already in the private sector. So what we need to do is make sure that the 400 public hospitals and the 265 private hospitals work more closely to deliver services to everybody. And the fund will purchase from both public and private providers, not just from the public sector, and they won't need 72 medical scheme for service payments.
Well, at least we did hear, Dr. Crisp, from the Health Minister that he does understand the concern about mismanagement, and that is mainly what South Africans are worried about. But I do understand that the bill would also assist, when passed, it would assist the missing middle in terms of the money that we'd be able to save, in terms of not having to worry about our loved ones that are not on medical aid, and even ourselves with the minimization of a co-payment, for example, in some of the medical aids that we pay for, paying a lot of money, and then you go to the doctor and they tell you that there's more money that you must pay to meet what the doctor charges. Thank you very much for speaking to us, Dr. Nicholas Crisp, the National Health Insurance Deputy Director General.